delivery body. Today we'll have multiple choice questions exam for medical students. Doctors undergraduate and postgraduate. Nurses. Hope you get benefits. But before we start, please like, share our videos, subscribe to our YouTube channel No1doctor. Follow us on social media accounts in description below the video. In each question you will have 4 choice. You have to choose one correct answer. Then explain why you choose it. Are you ready?
Yes, I am ready.
The average lifetime risk for a woman to develop breast cancer is approximately A.7%, B.12%, C.17%, D.22%.
The correct answer is B. The average lifetime risk of breast cancer for newborn U.S. females is 12%. The longer a woman lives without cancer, the lower her risk of developing breast cancer. Thus, a woman aged 50 years has an 11% lifetime risk of developing breast cancer, and a woman aged 70 years has a 7% lifetime risk of developing breast cancer.
How many lactiferous ducts drain into the nipple of the mature female breast? A 5 to 10, B 15 to 20, C 25 to 30, D 35 to 40.
The correct answer is B. The breast is composed of 15 to 20 lobes, which are each composed of several lobules. Each lobe of the breast terminates in a major, lactiferous duct, 2 to 4 mm in diameter, which opens through a constricted orifice, 0.4 to 0.7 mm in diameter, into the ampulla of the nipple. During
pregnancy, alveolar epithelium develops in the breast which is responsible after delivery for the production of milk. Which portion of the alveolar epithelial cell is responsible for production of the fat present in human milk? A. Endoplasmic reticulum, B. Mitochondria, C. Cell membrane, D. Cytoplasm.
The correct answer is D. With pregnancy, the breast undergoes proliferative and developmental maturation. As the breast enlarges in response to hormonal stimulation, lymphocytes, plasma cells, and eosinophils accumulate within the connective tissues. The minor ducts branch and alveoli develop. Development of the alveoli is asymmetric, and variations in the degree of development may occur within a single lobule. With parturition, enlargement of the breasts occurs via hypertrophy of alveolar epithelium and accumulation of secretory products in the lumina of the minor ducts. 2 distinct substances are produced by the alveolar epithelium: A, the protein component of milk, which is synthesized in the endoplasmic reticulum, merocrine secretion, and B, the lipid component of milk, apocrine secretion, which forms as free lipid droplets in the cytoplasm.
The medial mammary artery is a tributary of the A. second, third, and fourth intercostal arteries, B. lateral thoracic artery, C. thoracoacromial artery, D. posterior intercostal arteries.
The correct answer is A. The breast receives its principal blood supply from A. perforating branches of the internal mammary artery, B. lateral branches of the posterior intercostal arteries, and C. branches from the axillary artery, including the highest thoracic, lateral thoracic, and pectoral branches of the thoracoacromial artery. The second, third, and fourth anterior intercostal perforators and branches of the internal mammary artery arborize in the breast as the medial mammary arteries. The lateral thoracic artery gives off branches to the serratus anterior, pectoralis major and pectoralis minor, and subscapularis muscles. It also gives rise to lateral mammary branches.
Which of the following hormones is primarily responsible for differentiation of the breast ductal epithelium? A. Estrogen, B. Testosterone, C. Progesterone, D. Prolactin.
The correct answer is C. Estrogen initiates ductal development, whereas progesterone is responsible for differentiation of epithelium and for lobular development. Prolactin is the primary hormonal stimulus for lactogenesis in late pregnancy and the postpartum period. It upregulates hormone receptors and stimulates epithelial development.
Absence of the breast, amastia, is associated with A. Turner's syndrome, B. Klinefelter's syndrome, C. Poland syndrome, D. Fleischer's syndrome.
The correct answer is C. Absence of the breast, amastia, is rare and results from an arrest in mammary ridge development that occurs during the 6th fetal week. Poland's syndrome consists of hypoplasia or complete absence of the breast, costal cartilage and rib defects, hypoplasia of the subcutaneous tissues of the chest wall, and brachysyndactyly. Turner's syndrome, ovarian agenesis and dyschnesis, and Fleischer's syndrome, displacement of the nipples and bilateral renal hypoplasia, may have polymastia as a component. Klinefelter's syndrome (XXY) is manifested by gynecomastia, hypergonadotropic hypergonadism, and azoospermia. This is an increased risk of breast cancer in men with Klinefelter's syndrome.
The treatment of choice for Zuska's disease is A. Observation and nonsteroidal anti-inflammatory drugs (NSAIDs), B. Antibiotics, incision, and drainage. C. Wide resection of the affected area. D. Mastectomy.
The correct answer is B. Zuska's disease, also called recurrent periductal mastitis, is a condition of recurrent retroareolar infections and abscesses. This syndrome is managed symptomatically, by antibiotics coupled with incision and drainage as necessary. Attempts to obtain durable long-term control by wide debridement of chronically infected tissue and/or terminal duct resection are frequently frustrated by postoperative infections. Smoking has been implicated as a risk factor for this condition.
A clinically positive subclavicular lymph node is A level 1 node, B level 2 node, C level 3 node, D level 4 node.
The correct answer is C. The lymph node groups are assigned levels according to their anatomic relationship to the pectoralis minor muscle. Lymph nodes located lateral to or below the lower border of the pectoralis minor muscle are referred to as level 1 lymph nodes, which include the axillary vein, external mammary, and scapular groups. Lymph nodes located superficial or deep to the pectoralis minor muscle are referred to as level 2 lymph nodes, which include the central and interpectoral groups. Lymph nodes located medial to or above the upper border of the pectoralis minor muscle are referred to as level 3 lymph nodes, which consist of the subclavicular group.
Which of the following conditions leads to gynecomastia due to an increased production of estrogen? A. Klinefelter's syndrome. B. Hepatocellular carcinoma. C. Aging, senescence, D. Renal failure.
The correct answer is B. Estrogen excess results from an increase in the secretion of estradiol by the testicles or by non-testicular tumors, nutritional alterations such as protein and fat deprivation, endocrine disorders, hypothyroidism, hypothyroidism, and hepatic disease, non-alcoholic and alcoholic cirrhosis. Klinefelter's syndrome, aging, and renal failure all cause gynecomastia by a decrease in testosterone production.
The treatment of choice for Mondor's disease is A. Observation and nonsteroidal anti-inflammatory drugs (NSAIDs), B. Antibiotics, incision, and drainage. C. Wide resection of the affected area. Mastectomy. The correct answer is A.
Mondor's disease is a variant of thrombophlebitis that involves the superficial veins of the anterior chest wall and breast. In 1939, Mondor described the condition as string phlebitis, a thrombosed vein presenting as a tender, cord-like structure. Frequently involved veins include the lateral thoracic vein, the thoracoepigastric vein, and, less commonly, the superficial epigastric vein. Typically, a woman presents with acute pain in the lateral aspect of the breast or the anterior chest wall. A tender, firm cord is found to follow the distribution of one of the major superficial veins. Rarely, the presentation is bilateral, and most women have no evidence of thrombophlebitis in other anatomic sites. This benign, self-limited disorder is not indicative of a cancer. When the diagnosis is uncertain, or when a mass is present near the tender cord, biopsy is indicated. Therapy for Mondor's disease includes the liberal use of anti-inflammatory medications and application of warm compresses along the symptomatic vein. Restriction of motion of the ipsilateral extremity and shoulder as well as brassiere support of the breast are important. The process usually resolves within 4 to 6 weeks. When symptoms persist or are refractory to therapy, excision of the involved vein segment is appropriate.
The appropriate therapy for Paget's disease of the nipple is A. Topical steroid cream. B. Topical antifungal medication. C. Intralesional steroid injection. D. Resection.
The correct answer is D. Paget's disease of the nipple was described in 1874. It frequently presents as a chronic, echematous eruption of the nipple, which may be subtle but may progress to an ulcerated, weeping lesion. Paget's disease usually is associated with extensive DCIS and may be associated with an invasive cancer. A palpable mass may or may not be present. A nipple biopsy specimen will show a population of cells that are identical to the underlying DCIS cells' pagetoid features or pagetoid change. Pathognomonic of this cancer is the presence of large, pale, vacuolated cells, Paget cells, in the rete pegs of the epithelium. Paget's disease may be confused with superficial spreading melanoma. Differentiation from pagetoid intraepithelial melanoma is based on the presence of S100 antigen immunostaining in melanoma and carcinoembryonic antigen immunostaining in Paget's disease. Surgical therapy for Paget's disease may involve lumpectomy, mastectomy, or modified radical mastectomy, depending on the extent of involvement and the presence of invasive cancer.
In the Andy aberrations of normal development and involution classification, a 2cm fibroadenoma is considered a normal BA disorder, CA disease, DA premalignant disease.
The correct answer is B. The basic principles underlying the aberrations of normal development and involution Andy classification of benign breast conditions are the following. A. Benign breast disorders and diseases are related to the normal processes of reproductive life and to involution. B. There is a spectrum of breast conditions that ranges from normal to disorder to disease, and C. The Andy classification encompasses all aspects of the breast condition, including pathogenesis and the degree of abnormality. The horizontal component of Table 17-2 defines Andy along a spectrum from normal, to mild abnormality, disorder, to severe abnormality, disease. The vertical component indicates the period during which the condition develops. Fibroadenomas are seen predominantly in younger women aged 15 to 25 years. Fibroadenomas usually grow to 1 or 2 centimeters in diameter and then are stable but may grow to a larger size. Small fibroadenomas, is less than or equal to 1 centimeter in size, are considered normal, whereas larger fibroadenomas, is less than or equal to 3 centimeters, are disorders and giant fibroadenomas greater than 3 centimeters, are disease. Similarly, multiple fibroadenomas more than 5 lesions in one breast are very uncommon and are considered disease.
Which of the following conditions increases a woman's risk of breast cancer? A. Sclerosing adenosis. B. Fibroadenoma. C. Atypical lobular hyperplasia. D. Intraductal papilloma.
The correct answer is C. Atypical proliferative diseases include ductal and lobular hyperplasia, both of which display some features of carcinoma in situ. Women with atypical ductal or lobular hyperplasia have a 4-fold increase in breast cancer risk.
A 35-year-old woman with a BRCA1 gene mutation seeks your advice about her known increased risk of breast cancer. You should recommend a mammograms and physical examination every 6 months until she is 50, then bilateral prophylactic mastectomy. B. Mammograms and physical examination every 6 months plus tamoxifen. C. Prophylactic bilateral mastectomy and, if she has completed childbearing, prophylactic bilateral oophorectomy. D. None of the above.
The correct answer is C. Present screening recommendations for BRCA mutation carriers who do not undergo prophylactic mastectomy include clinical breast examination every 6 months and mammography every 12 months beginning at age 25 years, because the risk of breast cancer in BRCA mutation carriers increases after age 30 years. Despite a 49% reduction in the incidence of breast cancer in high-risk women taking tamoxifen, it is too early to recommend the use of tamoxifen uniformly for BRCA mutation carriers. Cancers arising in BRCA1 mutation carriers are usually high-grade and are most often hormone receptor negative. Approximately 66% of BRCA1-associated DCIS lesions are estrogen receptor negative, which suggests early acquisition of the hormone-independent phenotype. Tamoxifen appears to be more effective at preventing estrogen receptor-positive breast cancers. The risk of ovarian cancer in BRCA1 and BRCA2 mutation carriers ranges from 20 to 40%, which is 10 times higher than that in the general population. Prophylactic oophorectomy is a reasonable prevention option in mutation carriers. The American College of Obstetrics and Gynecology recommends that women with a documented BRCA1 or BRCA2 mutation consider prophylactic oophorectomy at the completion of childbearing or at the time of menopause. Hormone replacement therapy is discussed with the patient at the time of oophorectomy.
Which of the following statements about lobular carcinoma in situ, LCIS, is true? A. In general, LCIS occurs at an older age than ductal carcinoma in situ, DCIS. B. The majority of women with LCIS are premenopausal. C. LCIS is bilateral in 10 to 20% of women. D. Invasive ductal carcinoma can be expected to occur an average of 5 to 10 years later in approximately 75% of women with LCIS. The correct answer is B. LCIS tends to occur at a younger age than DCIS and the majority, approximately 2/3, of women with LCIS are premenopausal.
LCIS is bilateral in 50 to 70% of women. Approximately 25 to 35% of women with LCIS can be expected to develop invasive ductal carcinoma, an average of 15 to 20 years after diagnosis.
Moderate ductal hyperplasia of the breast is characterized by the microscopic finding of A 3 to 4 cell layers above the basement membrane, B 5 or more cell layers above the basement membrane, C obstruction of greater than 50% of the ductal lumen by hyperplastic cells, D obstruction of greater than 70% of the ductal lumen by hyperplastic cells.
The correct answer is B. Mild ductal hyperplasia is characterized by the presence of 3 or 4 cell layers above the basement membrane. Moderate ductal hyperplasia is characterized by the presence of 5 or more cell layers above the basement membrane. Florid ductal epithelial hyperplasia occupies at least 70% of a minor duct lumen. It is found in greater than 20% of breast tissue specimens, is either solid or papillary, and is associated with an increased cancer risk.
Which of the following is appropriate treatment for a 3 cm fibroadenoma? A resection, B cryoablation, C observation, D all of the above.
The correct answer is D. Removal of all fibroadenomas has been advocated irrespective of patient age or other considerations, and solitary fibroadenomas in young women are frequently removed to alleviate patient concern. Yet most fibroadenomas are self-limiting and many go undiagnosed, so a more conservative approach is reasonable. Careful ultrasound examination with core needle biopsy will provide for an accurate diagnosis. Ultrasonography may reveal specific features that are pathognomonic for fibroadenoma. In this situation, a core needle biopsy may not be necessary. Subsequently, the patient is counseled concerning the ultrasound and biopsy results, and excision of the fibroadenoma may be avoided. Cryoablation is an approved treatment for fibroadenomas of the breast. With short-term follow-up, a significant percentage of fibroadenomas will decrease in size and will no longer be palpable. However, many will remain palpable, especially those larger than 2 centimeters. Therefore, women should be counseled that the options for treatment include surgical removal, cryoablation, or observation.
Which of the following women with recurrent subareolar infection should undergo a total duct excision rather than a fistulotomy? A 55-year-old with nipple inversion, B 55-year-old without nipple inversion, C 35-year-old with nipple inversion, D 35-year-old without nipple inversion.
The correct answer is A. In general, the criteria for performing a total duct excision in a woman with recurrent subareolar abscessa, older age, larger diffuse infection, and nipple inversion.
Excellent. You passed the exam.
Thanks, doctor.
Thanks for watching. Hope to see you in more next videos. With my best wishes. Dr. Atef Ahmed.